Hi, I'm Becky DPT. Today I'm offering a physical therapy upper extremity strengthening program. It's nice and balanced, so we make sure that we hit all of the different muscle groups. We can do this in sitting or we can do it in standing. I have 3-pound weights, but we can also do our exercises with small cans, or you can even use water bottles just to add a little bit of weight. We can also just use our range of motion, so nothing in hand. So the first one, we're going to do a bicep curl. We're going to curl up and extend, and we're going to try to do 20 repetitions today. Nice and controlled movement when we perform these exercises. Very important for the muscle building to have control when we perform the exercise. Also, when we're performing the exercise, we want to make sure that we keep the wrist straight. We don't want the wrist kicking back. We want to keep that wrist nice and straight, elbows tucked into your side, right into that rib cage, just curling up and extending. I think we have about 4 more to go. Good job. Our next exercise is going to be a tricep kickback. So if we're sitting in the chair, we can just lean front. If we're standing, we can bend the knees slightly. We're going to pull those elbows back, relax your traps. Keep the ears away from the shoulders. You're going to roll back and down, hold your elbows up, and you're going to kick back. Fully extending those elbows. And again, nice and controlled. Wrists are nice and straight. All of these exercises can be done in sitting or in standing. So we always exhale with effort as we extend. Great job. So just to offer you a visual of how we can do those exercises in sitting, here is our bicep curl. And tricep, we're going to lean forward a little, hold the elbows up, and extend those arms back. So we bring those weights just into the waist and then back out. Our third exercise, we're going to do a shoulder press. Elbows tucked into your sides, palms inward, and we're going to push up and lower. If we are in standing, we want to keep our knees nice and soft, our chest up, nice and tall, extending those arms. Again, going for that 20 mark today. When in sitting, again, nice and tall, navel in, chest up and out, very controlled. Our next exercise is going to be a front raise. We're going to lift our arms straight out in front of us and alternate back and forth. This is working that front shoulder, which all of these exercises are strengthening the muscles that we need during the day, whether we are going and getting a glass out of the cabinet, or we're going to grab the milk to put some milk on our cereal. All of these exercises really help to benefit keeping us strong. And this one here can also be done 2 at a time, which then adds in the core. So we can alternate, or we can do both at one time. Your hardest point is straight out. And if we are sitting sideways, this is how it would look. So that's straight out and lower. Again, nice and tall with that core, navel in, back is supported. The next exercise is a lateral lift. So you're working that side shoulder. So we're going to lift up and out to the side, up and out to the side. This is also another exercise that can be done both at the same time, whatever you're comfortable with. For this exercise, we want to make sure that our palm is slightly facing forward. So we're in external rotation at the shoulder, which just means when we lift, we don't want to empty the can and turn those thumbs downward. We want to keep the palms facing up, out to the front, which helps keep that impingement away up in our shoulders. We have a few more left. And you can always alternate. And then once you get your strength back up, you can pick back up to performing them together, adding in a little bit more core work. And rest. So our next exercise is to strengthen our mid-back. So right in between those shoulder blades, we're just going to lean forward slightly, extend those arms, palms facing in, and we're going to row. Pull those elbows up and lower. Again, during effort, we exhale and inhale. Nice and tall, flat with that back. Very important for that posture. And controlled movement. Chin is up, nice and tall with that posture, leaning forward, navel in, chest up, chin up. How we doing? We're getting close. And rest. Hopefully you had a good time making your arms stronger. Have a great day.